Good afternoon, everyone, and thank you so much for joining us today. My name is Anne Fordham. I'm the Executive Director of the International Drug Policy Consortium, and this event is called Synthetic Realities, Global Drug Policies Beyond the New Threat Narrative. And we have a great lineup of speakers for you today, and I will introduce them one by one as we go through the event. I also want to thank our co-organizers, the New York NGO Committee on Drugs, the Canadian Drug Policy Coalition, the Canadian Association of People Who Use Drugs, the Drug Policy Alliance, and Mexico United Against Crime, and the Washington Office on Latin America. Also, in terms of other housekeeping, before I go on, this event will be held in both English and Spanish, and participants can choose their language by clicking on the globe function at the bottom of the screen there. We will also be recording this event in both languages and sharing that recording afterwards. Please do introduce yourselves, those of us who've joined us in the chat function. And yeah, I'm looking forward to hearing from the panelists and hoping that we'll have time for discussion at the end of today. Just maybe to say a few words about, why we decided to hold this event and this discussion on synthetic drugs right now. We felt the timing was quite crucial, as I think you may have seen in the promotional material and elsewhere, of course, that the United States government launched a global coalition to address synthetic drug threats in July of this year. Since then, I think more than 30 governments around the world have signed up to the coalition, and the coalition is designed to produce action and results in a short period of time to speed up the global response to the rise in synthetic drug threats. The coalition has 3 pillars, as you can see on their website. So the first pillar is to prevent the illicit manufacture and trafficking of synthetic drugs. The second pillar is around detecting emerging drug threats and use patterns. And the third is around promoting public health interventions and services to prevent and reduce drug use, overdose, and other health-related problems. In parallel, at this current UN General Assembly session this autumn, the US is tabling a resolution on enhancing action on synthetic drugs. So we really wanted to take this opportunity to have a discussion, I think really much more from the health and human rights perspective about how we should be responding from an evidence-based perspective to synthetic drugs. And also, encourage the discussion within the coalition to really elevate harm reduction as the sort of first line of response always, and really consider that this discussion that the US is now leading is a really important opportunity, I think, to inquire about what approaches have been working, what approaches have actually been exacerbating the problem, and really consider whether this is an opportunity to change course. So I'll leave it there by way of introduction, and I'll introduce our first speaker, who is our keynote, and I'm really delighted that we have her here with us today. Dr. Adiba Kamaruzzaman is with the Global Commission on Drug Policy, but she's also a professor of medicine and infectious diseases and a pro-vice chancellor and president of Monash University in Malaysia. She's also the immediate past president of the International AIDS Society and currently the co-chair of the WHO Science Council, and her longer bio will be in the chat. Adiba, we're so happy to have you with us. You have the floor. Thank you.
Thank you very much, Anne, and thank you all for inviting me to speak at this event today as a member of the Global Commission on Drug Policy. Good evening from Kuala Lumpur, Malaysia, actually. The Global Commission on Drug Policy is a leading international actor dedicated to promoting evidence-based drug policies that prioritize public health, human rights, and social justice. We comprise of world-renowned former political leaders and experts, and the Global Commission advocates for a paradigm shift in drug policy, moving from drug prohibition to more humane drug policies and practices. The Global Commission recommends drug policy reform mainly by means of the 5 pathways, and that is putting people's health and safety first, ensuring access to essential medicines and pain control, ending the criminalization and incarceration of people who use drugs, refocusing enforcement responses to drug trafficking and organized crime, and the 5th is to regulate drug markets to put governments in control. And here today we are discussing synthetic drugs, which are not a new threat. And since the Single Convention on Narcotic Drugs was signed in 1961, member states have responded with schedules and classification systems that have not been evidence-based or rationally linked to the harms and benefits of substances, but rather based on political choices. The current international drug control system has brought more and more psychoactive substances under international control, and today there are over 300 substances that have been scheduled. And we have seen the negative consequences of these punitive prohibitionist drug policies that continue to ruin lives around the world. 6 decades since the adoption of this 1961 Single Convention on Narcotic Drugs. And these punitive policies have been an important contributor to the current overdose crisis related to the synthetic opioids in North America. Now, counter to the intention of drug prohibition, with its goal of eliminating or substantially reducing the numbers of people who use drugs and the volume of drugs consumed, the actual number of people who use drugs has increased from an estimated 275 million in 2021 to 296 million in 2023. There also continues to be a general increase in the production of illicit drugs around the world. The surge in overdose deaths, especially in North America, has claimed hundreds of thousands of lives since 2019, while the total estimated number of drug use-related deaths globally was close to 500,000 in 2019 alone, which is fentanyl and other synthetic opioids have drastically altered the opioid market in North America with dire consequences, particularly due to the historical lack of investment in harm reduction and the continued criminalization and stigma associated with people who use drugs. In 2021, the majority of the approximately 90,000 opioid-related overdose deaths in North America involved illegally manufactured fentanyl or its analogs. It's therefore abundantly clear that drug prohibition, or the so-called war on drugs, has failed at all levels, and we believe law enforcement is not the answer. Indeed, drug prohibition has had a negative impact on the full range of civil, cultural, economic, political, and social rights, and has put people at even more risk, further entrenching discrimination and marginalized populations already facing exclusion and subjugation. The prohibition and thereby criminalization of the possession and use of psychoactive substances has resulted in harmful consequences for the most vulnerable members of our societies: women, indigenous peoples, ethnic minorities, children and young persons, people living with HIV and AIDS, members of the LGBTQIA+, homeless persons, sex workers, and others. Criminalizing people for the possession and use of drugs also increases health harms. For example, criminalization is associated with substantial increase in the risk for HIV and hepatitis C infection amongst people who inject drugs. And I welcome all of you to have a look at the most recent report of the Global Commission on the impact of criminalization and HIV and hepatitis C infection, and how far removed we are from the ending AIDS goals as a result of this. Due to the criminalization of drug use, people who use drugs are also far more likely to encounter the criminal justice system. Therefore, criminalization is essentially a state-sanctioned stigmatization of and discrimination against people who use drugs. Ending the criminalization of people people who use drugs, the third of the Global Commission's pathways to drug policy reform, is essential to address the ongoing overdose crises related to synthetic opioids, ending HIV, and eliminating viral hepatitis as a public health threat, and constitutes a prerequisite of any genuinely health-centered drug policy. Another crucial component is harm reduction of any public health and human rights. Harm reduction is a crucial component of any public health and human rights-based approach to drugs. The first of the Global Commission's five pathways for drug policy reform is to put people's health and safety first, instead of punitive and harmful drug prohibition. Policies should prioritize the safeguarding of people's health and safety, recognizing the fundamental human right to health. And this means investing in community protection, prevention, harm reduction, and treatment as cornerstones of drug policy. Sadly, after many decades, harm reduction services are not yet widely available at the level and scale required, for example, to end the HIV epidemic, despite all the evidence of its effectiveness. Fewer than 2% of people who inject drugs are living in countries with the UN-recommended levels of coverage of needles, syringes, and opioid substitution therapy. The opioid crisis around the world, whether it's in the United States or Canada or Scotland, with its harrowing number of deaths related to drug misuse, representing one of the highest prevalence rates in Europe and the world, are having a devastating human impact. The Global Commission acknowledges that an unconscionable number of people are dying from the consumption of synthetic drugs available through illegal channels. A significant number of these deaths could be prevented with better access to harm reduction services, such as overdose prevention sites, peer distribution of naloxone, drug checking services, safer supply, as well as access to opioid agonist therapy in the community as well as prisons. There is an urgent need to scale up harm reduction services so that people who need them are able to access them and to ensure that no one is left behind. Drug policies must be centered on human rights, including the fundamental right to health. Everyone, including people who use drugs, has the right to the highest attainable standard of physical and mental health. And this means the governments have an obligation to ensure that people who use drugs have safe, effective access to prevention, checking, and treatment services, including harm reduction services, which should be adequately funded, appropriate for their needs and circumstances, and respectful of human dignity. This is also intimately linked to the Global Commission on Drug Policy's second pathway, which is to ensure access to essential medicines and pain control. The international drug control system is failing to ensure equitable access to essential medicines such as morphine and methadone, leading to unnecessary pain and suffering by millions of people. More than 80% of the world's population has either no or insufficient access to or safe use of these medicines. The political obstacles at domestic and international levels that are preventing member states from ensuring adequate provision of such medicines must be removed. States around the world need to implement evidence-based public health solutions that protect and promote the human rights of all, including foremost the right to health. There needs to be universal access to harm reduction services and to controlled essential medicines for pain relief and palliative care. And there needs to be decriminalization of drug use and possession for personal use, a move to legal regulation, and an end to police violence and harassment. By building on the progress in harm reduction, treatment of drug dependence, access to controlled medicines, and decriminalization models, legal regulation of drugs, the last of the 5 pathways suggested by the Global Commission, can ultimately reduce social and health harms while disempowering organized crime and upholding the human rights of all. Indeed, in September 2023, the UN High Commissioner for Human Rights became the first UN senior official to call on member states to consider the responsible legal regulation of drugs as part of a human rights-based approach to drugs. The most effective way to reduce the extensive harms of the drug prohibition regime and to advance the goals of public health and safety is ultimately to bring drugs under control through responsible legal regulation. To conclude, we understand that the US has launched the Global Coalition on Synthetic Drug Threats because of the devastating situation they face. The overdose crisis, driven by the emergence of synthetic opioids and member states' lack of preparedness, certainly requires the attention of the international community. But we also need to make sure that this crisis does not reinforce the harmful war on drugs. Instead, the international community should seize on this opportunity to fully commit to drug responses that are grounded on human rights and scientific evidence, and that genuinely serve the health and welfare of humankind. I thank you.
Thank you so much, Professor Adiba. We really, really appreciate you being here with us today and your important, incisive and insightful remarks that I think, really merit attention by the coalition. So many of the things that you offer up in terms of the pathways are based on the evidence, harm reduction, removal of criminalization. These things are, critical, and we know what works in terms of responding to drugs from a health and human rights perspective. So thank you so much for your input. And I know you have to leave us now because it's very late where you are, so that's fine. Yeah, thank you again for being with us. So just to reiterate that I will not be opening the floor in between the panelists. We will open the floor at the end, but that will be for them to answer questions that participants have put into the Q&A function. So if you have questions for any of our panelists, please use the Q&A function. So moving on to our next speaker, I'm delighted to introduce Dan van der Gouw. Dan is a drugs market researcher from the Trimbos Institute in the Netherlands, and he has a wealth of expertise in terms of researching drug markets. So Dan, you have the floor.
Thank you very much, and thank you also for inviting me to this important panel. I'll try to share my screen. I hope this one is the right one. Is it okay? No?
Yes, it looks great.
Oh, okay, it's okay. So, okay. So I'm a sociologist from the Netherlands, from Trimbos Institute. I'll talk a bit about the work what we do related to synthetic drugs or drugs in general, and the outcomes of the health and social policies that we have implemented years ago to reduce harms and risk of synthetic drugs or drugs in general. Time is limited, so I will move forward quickly. About the term synthetic drugs, speaking from a scientific point of view, it's not the best way to talk about drugs, because scientific drugs, as we call it in the Netherlands, is a container term. It contains so many different sorts and types of substances, and for instance, drugs with very different effects and potencies, user profiles, risk profiles as well. And also it includes both substances that are used mainly for recreational purposes, such as ecstasy, but also used for pain relief, for instance, as tramadol, or medical purposes as ketamine. So it has a huge variety of different substances in this term, which is not the best way to address these issues, in our opinion. We also believe, the previous speaker also already mentioned that, but we believe that drug policies should be evidence-based. It should be based on evidence and not on morals or politics or fear. And having said that, in the Netherlands, we started off in the 80s, or actually in the 70s already, with a huge variety of different harm reduction services. So we have that, most of them are already for 40 years or 30 years. And the outcomes are really good if you look at the number of drug-related deaths, people living in the streets, and access to services and coverage of those services. Think of drug consumption rooms. We have over 20 of them in the Netherlands still. We have opiate agonist treatment. We have heroin-assisted treatment, drop-in centers. An important feature is also housing first projects. It's really very, very necessary and helpful. But also drug checking services. Actually, I work at the drug checking service as the coordinating office in the Netherlands. And we are doing this work for over 30 years, and it enables us to quickly intervene when extra dangerous drugs are on the market. Most of these services were also recommended in a recent EU-funded project called SOPREP, Synthetic Opioids Preparedness. It was a collaboration of several EU countries, European Union countries, and they actually identified those services as essential tools for responding to emerging drug threats. As we are researchers, we are in favor of data collection, and for any evidence-based drug policy, monitoring drug markets is essential. We always say in the Netherlands, measuring is knowing. Before you set up any policy, you should actually know what's really going on. Not what you think is going on or what you may fear that's going on, but what actually is happening in the drugs markets. So in the Netherlands, we have a huge variety of monitors. DIMS is drug checking. We have a monitor drug-related incidents. We have a THC monitor, which twice a year measures the content of samples that are sold in coffee shops, so cannabis samples. We have a reporting desk on new drugs, so basically on NPS, in which various labs work together, laboratories, forensic laboratory with a customs lab, and the consumer samples from DIMS that I work with. And we also monitor markets, so internet and internet-based platforms such as web shops, social media, and also the dark net, just to know what's going on, to have an additional view on what's going on markets and what may become used or popular in a specific country or a setting or a community. These are a few, I have no time to go in detail about that. These are a few of our red alerts over the last years. Red alerts, we call that, and it's basically the risk is where we alert when we have a drug alert. So we warn people for extra dangerous drugs on the market. You can see a number of these things here. It's cocaine alert was a few years back. It was actually heroin, white heroin, but it was missold as cocaine. People died, and through our drug checking service and our network and our early warning system, we were able to end this situation quite fast. And so basically what happens when we issue a red alert, the specific drug we warn for is quickly off the market. This is the app that we use, so people can use the app to be informed whenever we have a red alert or extra dangerous drugs on the market. So it's really important. A few words about banning substances. So banning substances benefits supposedly include that substances concerned lose their innocent image. It's legal, so it's okay to use, or it's illegal, so it's not okay to use. But we have seen that tobacco is still legal, but nobody would dare to say that it's a healthy thing to do. But on the other hand, ecstasy is illegal for many years and in many countries, but it still has this sort of innocent image. So it doesn't really work that well, banning for this purpose. Also, the fact that substances concerned may be more difficult to obtain. It may be true for some substances, but in the Netherlands, ecstasy was banned in 1985 already. But I think that the use have increased year by year, and still really a very popular substance, regardless of the fact that it's banned for so long. And also, and this is important, that in the banning substances, they have a variety of unintended consequences. It never or usually does not lead to the reduction in the demand for drugs. People demand for drugs, and when you ban one substance, well, basically they are looking for a substitute that actually also may be more risky than the substance that's banned. This is really important, and we have seen that through our drug checking service many times, that extra dangerous substances enter the market once another substance is banned. So it doesn't lead to the reduction in demand, but more to the pollution of the market, basically. So to conclude, so while addressing the issue of synthetic drugs, it's essential to prioritize the health perspective, and therefore governments should invest in the expansion and coverage of essential harm reduction services. They save lives and they are cost effective, and there's so much evidence that they actually work very, very, very well. Governments should also invest in structural and concise drug market monitoring and in data collection. Maybe in Europe, in some countries in Europe, the data collection is okay, it's in proper form, but many countries lack knowledge about what's on the market because they simply do not collect data and they don't monitor anything. Also important that governments address the demand for synthetic drugs, e.g., invest in treatment or in prevention activities. And finally, address social inequalities as a main driver of drug use. That said, probably I'm still in time. Here's some information where you could reach us or look into our data. Thank you very much.
Thank you so much, Dan. Very concise, to the point, sharp, very much needed, and your perspective is so critical in this conversation, as is the experience, I think, of the Netherlands, where, you know, a comprehensive full spectrum approach to harm reduction has been taken for a very long time, and there is a direct correlation with you know, lower drug-related harms across the board, providing that investment in harm reduction and, you know, ensuring social inclusion remains high. But yeah, I really appreciate you being with us today as well. So moving on to our next speaker, I'm delighted to introduce Teshia Naidu, who's the Managing Director of US Foreign Policy at the Drug Policy Alliance. And we're really grateful to have you here, Teshia, with us today to provide us a perspective from the United States. Thank you.
Thanks, Anne. And actually, I just want to say my computer has frozen, so I'm not sure if you can hear me. Can anyone hear me?
We can hear you, and I believe we can see you. So it's working for us.
Okay, so apologies for the technical details, technical difficulties. Greetings, and thank you so much to IDPC for hosting this very important discussion. Drug Policy Alliance is a US-based organization that advocates for policies, drug policies based on evidence, health, and human rights with an equity lens. And we are very grateful to be a part of this conversation. My remarks are going to focus on three main areas. One is to provide the historical context of the opioid crisis in the United States. Two, talk about what the current response is to the overdose crisis. And three, come up with a few suggestions that are not unlike what has already been suggested as responses that should be prioritized in the current context. So coming to the historical context, the synthetic drug issue and the use of synthetic drugs is not a new issue, as our keynote speaker has highlighted. And in fact, there have been very distinct waves of the overdose crisis in the United States that really traces back to the 1990s, when pharmaceutical companies heavily marketed opioid painkillers as effective for chronic pain management, whereas previously opioids were used for acute pain right after surgeries, et cetera. But after the over-marketing of these of opioid substances, we saw an increase in prescriptions for opioid drugs. And seeing the increased use of opioids, there were supply-side tactics that were used to crack down on overprescribers, having prescription monitoring systems, going after pill mills. And the effect of that was to reduce opioid prescriptions, but it didn't do much to address the demand. It didn't do much to address the underlying dependence that was created from these opioid prescriptions. And it didn't do anything to address the pain, the untreated pain. And so as a result, what we saw was the need was still there, and people moved to the underground market. And we saw that heroin popped up, heroin has always been a part of the market, but we saw an increase in heroin at the time because people needed to address the underlying concerns with either dependence or chronic pain management. Once again, we saw supply side tactics kick in, and that involved, heroin seizures quintupling over the period of time in the 2000s. Once the crackdowns on heroin, we started seeing the emergence of new synthetic substances that were adulterating the drug market. So the drug supply started becoming more and more toxic and riskier, as mentioned by the previous speaker. And so once again, these supply side tactics resulted in people continuing to use because demand was not addressed, and the demand was met by a much more riskier supply. As these synthetic substances started flooding the market, we're seeing crackdowns on fentanyl. And when that happened, fentanyl analogs started popping up in the market, and now there are calls for class-wide scheduling of all fentanyl-related substances. And while there might be some lip service paid to funding evidence-based treatment and harm reduction, we're very concerned that the same lessons of the same mistakes of the past are going to be repeated. And so that takes me to the current political context. I just want to also say one more thing, and I do apologize. Hopefully you can still continue to hear me because everything is frozen in front of me. The overdose crisis in the United States, as we saw the numbers increasing, heroin, at the time that in 2016, the overdose deaths relating to fentanyl were at 10,000 lives. In 2021, overdose rates are over 100,000 people. So it's certainly a huge crisis. As we're seeing evidence enforcement step up, we're also seeing that the overdose numbers are increasing. So clearly we're not doing the right thing. So yes, we have to acknowledge we're in a crisis and something needs to be done. But repeating the same mistakes of the past, relying on enforcement and interdiction, is not going to address the overdose crisis. The current political context in the United States, next year we have a presidential election. We have lots of senators up for re-election or open seats, together with the House of Representatives. The fentanyl issue and the overdose crisis is definitely being weaponized in political campaigns. We're seeing harsh rhetoric when it comes to this issue, with some people calling for a military response in Mexico, classifying fentanyl as a weapon of mass destruction. And in fact, in terms of scheduling, we've already had class-wide scheduling of fentanyl-related substances on a temporary basis, but the scheduling has, continued. It's still temporary, but now there are calls for permanent class-wide scheduling of fentanyl-related substances. Once again, instead of learning from the lessons of the past of how crackdowns and drug enforcement and interdiction leads to a more risky drug supply, we're seeing that our lawmakers are doubling down on punitive responses. But we do know what works. And as Dan mentioned, there are ways to address the crisis and center lives, like how to save lives, rather than falling back on the same failed approaches that we've tried now for decades. So I'd like to now turn to solutions. We know that in order to address a public health crisis, we need public health solutions, and law enforcement is not the go-to solution. We need harm reduction, evidence-based treatment. We know about methadone and buprenorphine, overdose prevention centers, drug checking, the way to save lives is to provide meaningful services where people are, to try and help them stay alive. I mean, I think that that's the first point that we should be focusing on, is how to keep people alive, how to prevent overdoses as a very initial matter, rather than constantly rushing to schedule these substances and use a criminal approach. A quick note on the Global Coalition. In the US, there's this rush for class-wide scheduling, as I mentioned. And the Global Coalition has the promise to usher in innovative responses, but it also has the risk of just repeating the mistakes of the past. To the extent that this coalition is designed to expedite scheduling at the international level, we're going to repeat the same mistakes of the past, because there are limitless configurations where substances could be created, and chemical tweaks can happen, and the drug supply will continue to be adulterated or evolve as crackdowns happen. So just want to conclude by saying that it's important to not repeat the mistakes of the past, and it's time to prioritize health and not pay lip service to it, not focus on interdiction and supply side tactics at the risk of meaningful interventions that will save people's lives. So I just want to thank IDBC again for hosting this conversation, and look forward to the Q&A.
Thank you so much, Teshia, and thank you also for providing some background that kind of precipitated the crisis that we see in the United States, especially with the overprescription of pain medication for chronic pain, and also how supply side tactics then have exacerbated the current drug toxicity and crisis that we see in the United States. And I think that's really important also to consider as we think about solutions, and the solutions you outlined, I think, are pretty much spot on. But we'll keep discussing those as we go through with the speakers today. So my next speaker, I'm delighted to introduce Andrei Zelensky. Andrei, hi, yes, there you are, great. It's great to have you with us today. Andrei is the contract manager and executive administrator of the Canadian Association of People Who Use Drugs. I think, as many of us are aware, Canada really has been at the front lines of this drug toxicity and overdose crisis. So Andrei, we're very much looking forward to hearing from you. You have the floor, and I love your t-shirt.
Yeah, I was just trying to share my shirt, which says, every death is a drug policy failure. And I'll elaborate on that momentarily. I'd just like to acknowledge that I'm joining you from Turtle Island, also known as Canada, specifically the city of Toronto, aka also known as Treaty 13, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Wendat, and many other First Nations, and as well as Inuit and Métis peoples. Canada is often seen as a leader in harm reduction and in the provision of services mentioned by some of the other speakers, including drug checking, including overdose prevention sites, safe supply. And I'll elaborate on some of those. Unfortunately, these services are limited to many large cities. Even in our nation's capital, Ottawa, a lot of folks, there's not really access to a proper drug checking service. A lot of people have to send in their samples to be checked through the mail. This is obviously results in a lag time where people aren't getting results immediately. And I use this as just one example of how in Canada we have safe supply, we have overdose prevention sites, we have drug checking, but none of these have been scaled up to the required levels. Canada is a large country. with diverse populations. And even as a person living in Toronto, there's only about 900 people on safe supply in the city of Toronto. In the city of Toronto, and in Toronto, in the Greater Toronto Hamilton area, there's about, I think, between something like 7 million people. It's just not good enough. If we want to meaningfully do something about the 21 or so overdose deaths that are happening every day in Canada, these services need to be scaled up, as has been suggested by some of the other speakers, and that's why I pointed to my shirt, which says every death is a drug policy failure. If we start with fentanyl, fentanyl is a synthetic drug that is used every day in hospitals safely for procedures like epidurals, and people don't die. The reason for this is because people are receiving that drug in a known quality, potency, and dose. In the unregulated market, this is not the case. There's adulterants, including benzodiazepines, xylazine, which is something that is used on animals and previously, and there's very little research on it. Benzodiazepines, I'm sure you're all familiar with, and people are actually becoming cross addicted to multiple substances at the same time, so that traditional OAT, safe supply, and other programs meant to kind of address the opioids that they're taking and substitute them aren't effective. Recently in Canada, there have been efforts by I'm a member of I work actually at the Canadian Association of People Who Use Drugs. We have drug user groups throughout our country who are fighting tirelessly against well-funded, powerful political opponents who don't want to see harm reduction succeed on any level. And we certainly we need to improve the literacy among the general population, among drug users, around folks all over the world when it comes to what safe supply is, what harm reduction is, what the evidence is, and what needs to be done. Just to elaborate on safe supply. So the safe supply that we receive in Canada is basically, Kaput actually coined the term safe supply years ago, and it was meant it was meant to give people who use drugs a safe version of the drug that they would traditionally be obtaining from the illegal market, the unregulated illegal market. What we have as safe supply isn't exactly that. People are receiving pharmaceutical versions. So, for example, Cadian, Dilaudid, or hydromorphone, Cadian, which is morphine, and the really sad thing is this is a little too late, because years ago when heroin was the predominant opiate obtained by drug users, seeking opiates on the street, those drugs would have worked fine. Dilaudid or Acadian would have met their needs. It might not have been the drug that they're seeking, but at least it would have been helpful. It would have been helpful. Unfortunately, now with fentanyl and the much higher potency of that drug, the safe supply that's being provided, while helpful and important, is simply not enough to meet the much increased tolerances of those individuals. So what I'm trying to say is that while Canada has in many ways taken steps in the right direction, many of these are pilot projects. And some groups, including, I'm not sure how many of you are familiar with the Drug User Liberation Front, but they, in the province of British Columbia, they attempted to take matters into their own hands. They sought government approval, they sought funding, they sought to make relations with pharmaceutical companies to obtain a safe regulated, checked supply of drugs to deliver to people. And they had some highly publicized drug giveaways. They started a compassion club, much in the same model as had been done with cannabis years ago, and everything was going quite well. They were receiving some really great publicity. Unfortunately, the publicity kind of went against them, and some politicians actually weaponized some funding that had been given to them. Dolph had made it very clear that the money used to obtain the drugs, that the checked, safe drugs that they were providing was coming from donations, and that other funds were coming from the funds they received from the government were being used to fund their OPS and their drug checking services. Unfortunately, the politicians conflated the two. It became a highly politicized issue, and Dolph was raided, about 3 or 4 weeks ago, and now that organization is. They haven't, unfortunately, haven't been charged. Well, fortunately, have not been charged. But again, I think that's for political reasons, as people don't wish for that case to go through the various levels of the Canadian judicial system. Even the Premier of British Columbia admitted that while, and I'm paraphrasing here, that while the life-saving work it admitted that Dolph was doing life-saving work, but at the same time, drugs are illegal, and therefore what Dolph was doing was unacceptable. Again, I'm probably paraphrasing that in some way, but you can look that up for yourself if you like. There have been so many unjust laws over the years that needed to be broken for meaningful change to happen, and this is just another example. And if we wish to move forward, there's going to need to be courageous people who do things that are not necessarily in line with the current laws. And Dolph made every attempt to do so legally, and was blocked. Was blocked at many junctures in that journey. We need Dolphs to spring up all over Canada, and quite frankly, like all over the world, in order to supply folks with a safe, regulated supply of drugs. And for folks on safe supply right now, it's highly politicized. There's politicians talking about removing these programs and eliminating funding for them. I'm just on the one hand, I'm coming to plead with you to just pay attention to what's going on in your own countries, and just highlight the importance of education and of literacy around harm reduction, around these issues, so that the general public, who was raised on a at least in North America on just say no, and all sorts of drug war propaganda, can have their minds open to the realities of what's going on. And as one of my fellow speakers brought up, housing is also an important component of this. There's many people who use drugs very safely and quietly in the comfort of their own homes, and who are not on the front lines of the media coverage of drug users. And unfortunately, those on the front lines are those that are unhoused. Those that are most vulnerable are those that are unhoused. So these two issues are intrinsically linked, and providing stable housing and providing meaningful harm reduction services must happen in lockstep and in a comprehensive manner, so that we can provide wraparound services that really uplift folks and create a better, more livable society and quality of life for everyone. We don't want to see, we don't want to devolve into a situation where people who use drugs, like why should anyone who carries a substance be put in jail, criminalized? Nobody wins from this situation. So. I would just like to thank you for this opportunity to speak, and if anyone has any questions, I would be more than happy to answer. Thank you so much.
Thank you so much, Andre, and thank you for, your impassioned intervention. I always think of the situation in Canada with such a heavy heart, and I do completely agree that it is, a devastating drug policy failure to have the situation that we currently have, and then the work of the Drug User Liberation Front and many other brave actors, supporting peer-to-peer to keep people safe needs to be applauded. And I'm also appalled by what happened to this organization. And we'll try and share a bit more information about DOLF, that's the acronym in the chat, for people who are unaware of what happened to this organization and how they were cracked down in a very devastating way. Okay, so moving on to our next speaker. Also delighted to have with us Lisa Sanchez. Lisa Sanchez is the Executive Director of Mexico United Against Crime. And Lisa will really give us the perspective of the fentanyl situation in Mexico, but also politically how this conversation is evolving also with respect to the US. Thanks, Lisa. You have the floor.
Thank you, Anne. Good morning, everybody, and greetings from Mexico. For the sake of time, I will be speaking in Spanish, so please, if you need interpretation, do activate all the controls that you need to listen to this conversation in English, and thank you so much for the interpreters who are gonna translate what I say today.
So like Anne was saying, part of what I would like to say today on this event has to do with the level of evidence that we have to be able to take political decisions at the national level here in Mexico and at the binational and international level. So we know that there is a large effect on public health in these countries, especially in the United States, Canada, and others because of the toxicity of these drugs and the absence or lack of sufficient responses that are based on access to services and harm reduction services. I think it is important to know as well that we must question the effects of the strategy that we use in these situations, in these countries where we're seeing such a huge crisis in terms of drug use, where what we see we're adopting a criminalizing strategy once again. And we're seeing that the international response is actually using this drug control and prohibitionist strategy. We're not going to be effective if we use this because we're not actually responding to the root of the cause, the root cause. We're also going to cause other issues in other countries. And this means that we're going to make the problem even worse. So needless to say, for countries like Mexico, which have traditionally been viewed as producer and trafficking countries, where the war on drugs model and the militarization of security have been applied to an extreme degree, I think one of the most extreme degrees at the international level, we see that the risk of such a response being consolidated at the global and bilateral levels is enormous, while ignoring the evidence. And so this is a very large risk that we are running here. So what do we know about the fentanyl market in Mexico? Because I think that what we know and what we ignore is both these things are just as important and just as relevant today. And this is how we can have a comprehensive response, is by actually being aware of what we know and what we don't know. Since the outbreak of this crisis, especially in North America, what we've seen is that there has been, not in just these countries, but also in Mexico, there's a sort of hegemonic narrative in which Mexico and other countries are viewed as the main culprits responsible for the production, importation, exportation, and illicit trafficking of not just synthesized fentanyl, but also its pre-precursors and precursors. Based on this characterization, there's been an unproductive dialogue ensued between the two countries in which the United States points out the responsibility of the Mexican state and Mexico has also developed a narrative based on fear. And we see how this is very problematic as well as the national response. And we're seeing how things are very difficult because of this. So what do we know in terms of precursors, precursors, and essential ingredients? We know that although these are distinct markets, it is tempting to control them all equally and to presume their use for illicit purposes, even when this has no chance of resolving the problem. And so it's assumed that they're going to be used for criminal purposes, and it's not actually proven, and we don't have enough data about this. In this sense, there are a lot of compromises or commitments, for example, between the presidents of Mexico and China in the Asia Pacific Economic Cooperation meeting in mid-November 2023. We see how they agreed to cooperate against the illegal trafficking of precursor chemicals that favor the production of synthetic drugs. And we continue to deal with a lack of evidence. As an example of what we know, the data really vary depending on who is providing them, what part of the country. In Mexico, there's also a lot of contradictions, very significant contradictions. It depends which agency you're listening to. One agency will say one thing, another will say another, and it's really hard to know what is the actual truth. We also know that these data do not corroborate the data of, for example, the 2023 high-level security dialogue. For example, the Mexican government says that in the last 5 years, they've destroyed 2,100 illegal laboratories, and that they have seized around 1.5 tons of precursors and chemicals, which means that they have prevented the production of approximately 7,288 tons of methamphetamine. But there is no precise figures linking this with actual fentanyl trafficking. On the other hand, in the United States, the US government says that it has made more than 7,000 fentanyl seizures with a total of around 52,000 pounds of fentanyl. Of this total, approximately 35,000 pounds were seized at the Mexican border. So what is it that we don't know in terms of the discrepancy of these data and these figures? And because we don't know where these precursors are actually coming from, then how can we know how they're actually reaching and being disseminated in the United States? The Mexican government does not acknowledge the use of these substances in this country, and they just say that the pills that the fentanyl is mixed with are produced in Mexico, but not the fentanyl itself. Meanwhile, the United States is saying that they actually are producing fentanyl, and we see a lot of focus on Sinaloa and Jalisco. So it's important that we have data because it's possible to actually create a comprehensive public health response without knowing exactly how much fentanyl is being produced in Mexico, how much is coming from outside Mexico, and how much fentanyl is actually reaching through these illegal trafficking and illegal production chains to reaching the United States. And in Mexico as well, this lack of data is actually holding back useful responses at the public state level. And the return to status quo after Mexico's position had become much more balanced following the 2016 UN General Assembly, meant that the National Consumption Survey was actually canceled, which means that the most recent data that we have on consumption in Mexico are from 2017. When it comes to the data that we have, we actually know them from civil society organizations, like for example, organization known as Verter, which is based in Cali. Of this, we know that of the 1,200 overdose calls that they had responded to in the last 2 years, all of them tested positive for fentanyl. And in states like Baja California, we know through the forensic medical service.
Uh-oh. Sorry about that. We'll see if we'll give her a minute or two to come back.
So I was saying that the information that we have available on the drug market, and especially the information that we have about fentanyl specifically, is very scarce or very very low. It's not enough to actually be able to make enough public policy decisions. So what we need to demand is that there is enough data so that we can actually base our decision making and our policies on actual evidence and data that has been corroborated and verified. And so this is not just so that we can have an effective bilateral response, but also so that we know that everything is taken into account. Because by externalizing the blame and by focusing on criminalizing responses, we're actually going to create even more issues like what we're already seeing in countries such as Mexico. So at the beginning of my speech, I was saying that Mexico is one of the countries that has most followed things by the book. It's followed the kind of letter of the law of international drug control measures. It's really complied with the demands made by the so-called war on drugs. Even though we've seen more than 400,000 people killed in Mexico as a result of this. And despite this, there hasn't been a debate about the effectiveness of these strategies in the country. And there hasn't been reflection on an alternative policy or an alternative strategy. Instead, the Mexican government has focused on the sort of moral panic and on spreading fear to help validate these kinds of policies, which continue being the perfect incentive to increase the militarization of public security. In Mexico, where we haven't seen, we not only have they not stopped illicit drug trafficking, but there's actually been even more. And we've seen a lot of human rights violations, a lot of disappearances, many difficulties and issues with the system. And we've also seen how many needed reforms have been walked back. And reforms that are needed for the justice system and our security system, when what we really need is good drug policy. So when it comes to the issue of overdose and synthetic fentanyl, there's a lot of reflection that we ask the international community to engage in. We need to move away from criminalizing policies which don't actually resolve the crisis, and on top of that, they actually create other crises, like we are living here in Mexico. And these other crises are really bad for the region of Latin America as a whole, and they're not good for North America either. So it is based on this reality that we're actually asking there to be consideration at the international community level. We need to base our actions on evidence and on creating the data and collecting the data that we need. We need to avoid criminalizing people who use drugs, including synthetic drugs. And we also need to increase the availability and access to harm reduction and treatment services for the people who use drugs in Mexico and in other countries where drugs are being used. instead of focusing on a security response that focuses on criminalization and preventing access to these services and other substitution therapies like methadone. In Mexico, for example, we have this idea that harm reduction is actually giving people the permission to use drugs, but really we need to move away from this narrative. We also need to guarantee that all of the decisions that we make take into account access to controlled medicines. We've seen how in Mexico, surgeons and doctors who use fentanyl in a legitimate purpose for medical and surgical use are being criminalized, and because of this moral panic and this
Lisa,
environment
sorry, could you
fear.
wrap up in 30 seconds?
And finally, we need to demand the excited modernization of the international drug control system to accommodate alternative policies to prohibition that eliminates the illicit drug market and criminal incentives to develop more potent drugs capable of evading the international control system. Thank you very much. Thank you very much, Anne. Thank you very much to the rest of the panelists, and we are here for any questions you have.
Thank you. Thank you so much, Lisa. Yeah, you covered many important points there, including reflecting on, what needs to happen at the international level in terms of the drug control system. So moving on to our final speaker, we have Smriti Rana. Smriti is the head of strategic programs and partnerships at Palam India. And Smriti, we're really delighted to have you today to address the issue that actually Lisa picked up on just now, the importance of synthetic medicines for legitimate medical use, and how availability is often hampered by the international scheduling of these substances. Thank you. You have the floor. And sorry, you have 8 minutes because we really hope that we'll have time for some discussion at the end. Thank you.
Thank you, Anne, and thank you, IDPC, for having a seat at the table for palliative care, because whereas I think these platforms are really important for us. And thanks to the panelists also who highlighted access to medicine as an essential part of drug policy. So when we talk about regulations that seek to schedule and restrict access, we need to view these in the context of medical need as well. So from the perspective of palliative care, this includes the pain burden experienced globally, especially in low and middle income countries. According to a Lancet Commission report, there is no access to pain relief or palliative care for over 80% of the global population, and that's a staggering statistic. In my country, in India, more than 1 million people in India have they suffer from moderate to severe pain every year due to advanced cancer. And if you include people with non-cancer conditions like HIV and progressive, incurable, or otherwise life-limiting conditions, the number rises quite drastically. And experts estimate that more than 7 million people may suffer from pain and other symptoms because of such illnesses. Only a small fraction of these people have access to adequate palliative health services. And in India alone, the amount of morphine equivalents used to adequately treat patients suffering from moderate to severe pain is less than 4% of those requiring it. And because opioids are controlled substances globally and are therefore not freely available on the market, ensuring their availability for medical purposes is more complicated than it is for most other drugs. I just like to put in a word of caution about evidence. When we weigh the risk-benefit ratio of any drug, we have to consider the fallacies associated with the evidence. And the bulk of evidence generated is from research funded by the industry. And very little research is actually done on inexpensive medicines, leading to a publication bias. Also, more than 90% of publications come from 15% of the population, mostly in high-income countries. So we need to be wary against knee-jerk reactions when evidence is brought against inexpensive medicines. An August 2022 publication, it's called Why Most Published Research Findings Are False, stated that the greater the financial and other interests and prejudices in a scientific field, the less likely the research findings are to be true. And it went on to claim that 1 in every 3 articles in its sample had at least one author with a financial interest. And this has significant impact when drug companies are the main source of information behind proving which products are most effective. So based on this evidence, when inexpensive medications are brought under stricter regulation, it doesn't impact high-income countries, global north, where alternatives are available as much as it does the low-income and low and middle-income countries. And in our settings, the absence of access to low-cost formulation, what happens is high-cost formulations are not just prescribed, but promoted. And in spite of belonging to the same class or covered by the same regulation. So if the patient can't afford these, they are then pushed into the overuse of other less effective medication. And self-medication with over-the-counter prescription drugs becomes an issue. And quite alarmingly, even doctors end up prescribing medicines with terrible side effects, which actually compounds the suffering. And the cost is a major consideration where we live, where unlike the global north, in India alone, 55 million Indians are pushed below the poverty line annually because of catastrophic out-of-pocket healthcare expenditure, of which approximately 38 million are pushed below the poverty line because of the cost of medicine alone. So let's talk about, the fact that, in global south countries, which are already facing massive crisis of unrelieved pain, to further hamstring them from having access to these low-cost medicines it's nothing but a travesty of justice. So when we are talking about ketamine, I'll just quickly touch upon ketamine. While it's primarily an anesthetic, it's also used in specific chronic pain situations. And unfortunately, diversion for recreational purpose is possible, but this is a solvable problem. But the issue is that experts are not usually consulted. And it's not just essential, but most often the only option as an anesthetic in low resource settings and in places without uninterrupted electricity or oxygen. It's vital for emergency surgeries and procedures where there's no respiratory support and skilled anesthetists may be overburdened by the volumes of surgeries that they have to conduct. It's on the WHO list of essential medicines, and a WHO official actually said that controlling ketamine internationally could limit access to essential and emergency surgery, which would constitute a public health crisis. And Dr. Liz Goethe, who's the CEO of the Hospice and Palliative Care Association of South Africa, has said that hundreds and thousands of people who need emergency surgery will die or suffer intense pain if ketamine becomes scheduled or becomes something that only can be prescribed by a doctor. And moving on to tramadol, in India, tramadol, codeine, and buprenorphine are the only drugs available on the WHO Step 2 ladder, which is suitable for treatment of moderate pain. Tramadol is a centrally acting analgesic, combining both opioid and non-opioid mechanisms, and has been used to treat moderate to severe cancer and non-cancer pain for many decades. Now, in countries like India, there is limited or no availability of controlled opioid analgesics. And although tramadol does not have the same potency as strong opioid analgesics, it is often the only option available. So in 2018, a study on the current role and clinical use of tramadol in Southeast Asia, pain specialists from 7 countries in Asia were invited to participate in a survey. And their findings showed that the main reason for choosing tramadol to manage pain in Asia is reflected by its high use, and it's reflected by its high usage, is its efficacy, tolerability, availability, reasonable cost, multiple formulations, and patient compliance. And very quickly, its safety profile makes tramadol particularly appropriate for use in elderly patients, outpatients, and long-term treatment, and is a decisive factor in its usage. Even non-steroidal anti-inflammatories, which are known to cause renal and gastrointestinal impairment with long-term use, so tramadol becomes a better alternative because it doesn't have those side effects. And very importantly, in our cultures, it is less stigmatized than opioids like morphine, and so that leads to better patient compliance. So regulation of tramadol would not only impact pain management, but may result in substitution with other medicines with higher incidences of side effects. And the respondents of that survey actually very strongly agreed that tighter regulations of tramadol would reduce its medical availability and adversely affect the quality of pain management. In some countries, there would no longer be any appropriate medicine for cancer pain or long-term treatment of chronic pain at all. Various WHO committees routinely advise the UN Commission on Narcotic Drugs on what should be designated as a controlled substance. Tramadol has been assessed several times, and each time it was decided not to bring it under international control. Pain is an important public health issue, and the International Drug Control Treaties places on all member states the dual obligation to prevent non-medical use of controlled substances and equally to ensure adequate availability. Of these two core imperatives, one is restrictive, seeking to limit access to controlled medicine and to prevent their manufacture, distribution, possession, etc., for recreation and entertainment. The other is enabling, to ensure that people who need these medicines to relieve their suffering are not denied it. And we're obliged to both prevent addiction and to treat pain. The fact remains, though, that the balance is tipped towards control. And there's a saying, if you don't have a seat at the table, you're probably on the menu. So who's at the table? Who's making these decisions? Um, Colonialism has expressed itself in waves, from formal colonization to the current waves of neocolonialism. And current policies are largely determined, influenced, and imposed by the global north. And significantly by the US narrative also, and are centered around licensing, prescription control. And decisions that directly impact low income countries are still made in Geneva, in Vienna, which remain out of reach to those whom these decisions impact the most. And many global south countries don't even have diplomatic mission in these places. So we don't even make it to the table. And there is inadequate consultation with the low and middle income countries. Western corporate capture continues to dictate and shape what is available in terms of essential medicines and what's put in packages that are reimbursable. So the problem is with illicit production, trafficking, and sale of psychoactive and other substances, not the substances themselves. And so the phrase which you see on the website of illicitly manufactured synthetic drugs such as fentanyl, tramadol, etc., it's misleading. It seems to indicate that the problem is not only the illicit manufacturing, but the drugs themselves. And there is an enormous public health benefit and medical need for safe accessibility to all of these, synthetic drugs like ketamine, fentanyl, and tramadol. And these substances, by all means, can be extremely harmful when manufactured and trafficked illicitly. But automobiles and airplanes are also very dangerous if not used properly. The substances are not the problem. They are important social goods. The world community needs to find a way to stop illicit manufacturing and trafficking without reducing safe access to them for, especially where they're already inadequately accessible, like in low and middle income countries. So we really need to reimagine controlled substances through a post-colonial framework, which is informed through discussion with a more diverse set of stakeholders. And we all really need to focus on not just improved access, I'm saying from the palliative care perspective, but on safe access, on well-calibrated, compassionate, and smart regulatory systems, and fit-for-purpose supply chains and for controlled medicines, while simultaneously providing the guardrails and the safeguards of proper training and balanced evidence and about the safe use of these substances for pain relief and other medical purpose. And finally, I'll just say that, we see control and access as being on two opposing sides, with the arguments being made in terms of harm versus effectiveness or value, as opposing forces on this principle of balanced scale. But there is a way to package these two issues together, and perhaps that balance comes from focusing on the suffering of the individual and their families, and to really zoom into the microcosm of who is most impacted and to what degree. So I'll stop with that, Anne.
Hi, Smriti. Thank you. Thank you so much. And this perspective often is, I think, somewhat overlooked in these conversations, right? The absolute critical importance of, the medical use of many substances that are considered to be illicit drugs, and the focus is instead on the harms of so-called illicit use, but actually as we ban and schedule them, not taking care of legitimate medical use, and also the disparity between availability of substances for pain and palliative care that we have in the global north versus the lack of access in many countries in the global south. So so thank you so much for our incredible panel. I mean, so many powerful interventions from such a range of perspectives that will inform our discussion. I believe that actually, as we started this conversation with the framing that the point of having this conversation today is to somewhat provide perspectives on the US-led global coalition on synthetic drug threats. So I know that we have with us today Andrew Thompson, who is an advisor with the State Department and is very much involved in sort of, yeah, the US coalition. So Andrew, we wanted to give you the opportunity to respond and basically share your perspectives on what you've heard from our panelists today. So yeah, I'm delighted to see you, and yeah, would like to give you the floor for some responses.
Thank you very much. Can you hear me?
I can.
Excellent. Thank you for the opportunity to share an update today on U.S. government-initiated efforts to address the public health and security threats of synthetic drugs, in particular the Global Coalition to Address Synthetic Drug Threats. We appreciate the interest in this topic, which impacts many of us in a deeply personal way, and we appreciate the efforts of IDPC and all the panelists to share global perspectives on the issue and on the response. First, let me say the United States is committed to engaging with all partners ahead of and during the 67th UN Commission on Narcotic Drugs to undertake an honest assessment of where we are and where we're going. We are constantly assessing whether our counter-narcotics approaches are achieving their intended results. We recognize that some of the approaches used in the past have failed to achieve the desired results. We learn from those failures, we analyze the information that we gain from them, we maintain what works, and we adapt what doesn't to achieve better outcomes in the future. Today, U.S. counter-narcotics policies increasingly prioritize an enhanced focus on human-centered and health-based approaches to address substance use, including investing more in prevention, treatment, recovery support, and harm reduction services and tools than ever before to help people who use drugs enjoy the highest attainable standard of physical and mental health. At the same time, we are prioritizing law enforcement resources toward identifying and disrupting the large-scale and transnational criminal organizations responsible for manufacturing and trafficking in the dangerous substances that are causing death and disability in our communities. U.S. priorities, in particular those related to addressing the overdose and addiction crisis, in line with the Biden-Harris administration's National Drug Control Strategy, reflect a balanced approach to drug policy in which saving lives is our North Star. At an international level, we remain the largest donor to the major international and regional organizations addressing substance use around the world, and we have supported the development of numerous initiatives that today have created a global ecosystem to strengthen national and local responses to address substance use from both a public health and a national security perspective. We appreciate the opportunity to share more information with you today and to hear your feedback. On the coalition, in July 2023, Secretary of State Blinken launched the Global Coalition to Address Synthetic Drug Threats, with senior leaders from nearly 100 governments and international organizations represented. The ministries that participated from those countries and the ones that have since been participating in coalition activities range from ministries of foreign affairs to ministries of justice to ministries of health to drug policy ministries. Truly a multifaceted, multi-sectoral group. The ministerial declaration from that event reflects the inclusive and balanced approach which is guiding the coalition's work. The coalition is built on a shared understanding that the rise of synthetic drugs represents a fundamental shift in drug markets, and that while the specific drugs present in each country may vary, drugs created through synthetic processes share a number of important features in common. These shared characteristics of synthetic drugs present new vulnerabilities for the existing international drug control architecture, but they also provide new opportunities for enhanced international cooperation. Since its launch, the coalition has grown to include 134 countries and 11 international organizations, reinforcing widespread recognition of the global threat of synthetic drugs. Having solidified political commitments at the highest levels on the need to enhance international cooperation on this issue, the coalition is now focused on identifying challenges and recommending solutions. On September 1st, we launched working groups on 3 priority topics. First, preventing the illicit manufacture and trafficking of synthetic drugs. Second, detecting emerging drug threats and use patterns. And third, promoting public health interventions and services to prevent and reduce drug use, overdose, and other health-related problems. In mid-October, the coalition launched 7 sub-working groups to identify and advance concrete actions and outcomes under these 3 priorities on the following topics: manufacturing of synthetic drugs and their precursors, trafficking of synthetic drugs, data collection, analysis, and trends, including early warning, information sharing, interagency collaboration, and policy formulation, preventing drug use, engaging people with substance use and substance use disorders, and addressing populations in contact with criminal justice systems, including alternatives to incarceration. Each sub-working group is now meeting monthly between now and March to identify challenges, under each topic and brainstorm solutions. They've already identified several promising ideas, including assessing prevention systems to achieve greater scale in preventing drug use, establishing networks of legislators and parliamentarians to develop and adapt legislation, expanding access to harm reduction services globally, including naloxone, developing new approaches for addressing stimulant use disorders, working with criminal justice institutions worldwide to develop and adapt alternatives to conviction and punishment, and strengthening drug detection and early warning systems. We recognize the importance of engaging civil society in this effort as well. This includes inviting the 134 countries currently represented in the coalition to organize national civil society roundtables that engage relevant groups and generate feedback on issues related to the 3 working group themes of the coalition. It also includes partnering with the Vienna NGO Committee on Drugs to host a virtual civil society forum in early 2024 to provide an opportunity for international NGOs to share their perspectives and recommendations with coalition governments. And it includes inviting civil society organizations to provide further feedback through videos, presentations, documents, and other submissions to the coalition's website, which is globalcoalition.us. This feature will remain open through September 2024 for the duration of the coalition's envisioned lifespan. At that time, in late 2024, we expect to have a final engagement to mark the close of the coalition's time-bound efforts, reflect on our results, and commit to continuing our work through existing multilateral fora moving forward. The United States will use our foreign assistance resources to support implementation of coalition deliverables, including in consultation with civil society and through support to civil society, and we will encourage coalition participants to do so as well. Thank you for the opportunity to share a U.S. perspective on these issues today, and we appreciate your continued engagement on this important subject. Thank you.
Thank you so much, Andrew, and thank you for being with us today and hearing all of the input. And, you know, you said some things there about the work of the coalition, which I think for us and the conversation we've had today are incredibly important. So it is reassuring to hear that, you know, there is an emphasis on scaling up harm reduction in this context, and of course addressing alternatives to conviction and punishment as well, as you mentioned. I'm afraid that we're pretty much out of time. We have just 1 minute left. I think, you know, we will please continue this discussion with our speakers. Speakers, please, you know, if you're happy, please share your contact details in the chat, because many colleagues have been asking to make contact with you. I'm really delighted that so many people joined us today. I think that really, you know, there were so many key points that were made, but the emerging theme is that, you know, we have learned so much from how policy can simply create further harm. And, you know, we need to understand that we need to shift away from those harmful policies that have simply led to what we see now in the US and Canada in particular, this devastating crisis of overdose with a potent, unpredictable, and toxic drug supply. You know, government responses that are based on supply side measures and law enforcement have simply made the problem so much worse. These policies do not keep communities safe. They do not reduce drug use. And we need to really center putting people first and saving lives. And that will require, I think, a seismic shift in government attitudes towards drugs, towards people who use drugs, and towards centering harm reduction. You know, I want to respond briefly to Andrew and the US coalition. I've heard, you know, Secretary Blinken refer to the US as the canary in the coal mine in terms of alerting the world around synthetic drug threats. But I think, yeah, if you're that canary, I think a big part of it has to be to acknowledge the failure, the absolute failure of repression and punishment as a way of controlling drugs, and point to the US example of what has happened there. Anyway, I will leave it there. I really appreciate all of your attendance. I really appreciate all of the speakers. Thank you so much for your incredible interventions. And yeah, I hope we can continue this discussion in many different forms and ways. And also, to pick up on Andrew's point of the the global consultation with civil society. That will be a great moment also to continue the conversation. I hope that it can also be not only with the Vienna NGO Committee on Drugs, but also with the New York NGO Committee on Drugs, who are also co-sponsoring this event with us today. Thank you so much, and we'll leave it there. Thank you.